All right, let's dive in. Today, we're going to take a tour of a tiny, kind of hidden gateway in our anatomy. It's a small passageway that most of the time is totally harmless, but it holds the potential for a major medical emergency. We're going to find out exactly why.
So let me ask you something right off the bat. What do you think is the body's most vulnerable passageway? The answer might actually surprise you, and by the end of this, you'll know exactly why this tiny little spot is such a prime candidate.
And here it is. This is our map for the journey. Just take a look at this cross-section of the upper thigh, right where it meets the abdomen. You've got the big players here, right? The femoral nerve, artery, and vein. But we're going to focus on that tiny space right next to them. See it? Highlighted there as the femoral canal.
So yeah, that little space we just pointed out, it's known as anatomy's hidden gateway, and it's a really crucial but often overlooked passage that connects two massive regions of the body.
To really get a handle on this thing, we've got to map out its borders first. Because, understanding what surrounds this canal is the absolute key to seeing both its purpose and its hidden dangers.
So what is it officially? Well, the femoral canal is the small, innermost, or medial, if you want to be technical, compartment of a bigger structure called the femoral sheath. Its main gig is to be a passageway. Sounds simple enough, right? But trust me, the devil is in the details.
Think of the canal like a tiny four-sided tunnel. It's defined by four key structures. You've got the inguinal ligament in the front, the pectineal structures in the back, the lacunar ligament on the inner side, and the femoral vein on the outer side. Let's break down what those actually are.
Okay, so the anterior wall, you can think of it as the roof of this tunnel, that's the inguinal ligament. This thing is a tough, fibrous band that you can actually feel on yourself, running from your hip bone down to your pubic bone.
Then you've got the posterior wall, or the floor, which is made up of the pectineus muscle and the ligament that covers it. This whole setup provides a really solid base for the canal.
Now, the inner wall, this is a really interesting one. It's formed by the lacunar ligament, which is this sharp, crescent-shaped structure. And I need you to remember that detail. It's sharp and it's rigid. That is a critical piece of this puzzle.
And finally, get this, the lateral border, the outer wall, it isn't a ligament at all. It's the femoral vein itself, one of the major blood vessels of the leg. So this tiny canal is literally snuggled up right against some critical plumbing.
Okay, so those are the walls. Pretty solid, right? But what's actually inside this little tunnel? Let's take a peek.
Surprisingly, not a whole lot. It mostly just contains some lymphatic vessels, a few deep inguinal lymph nodes, a bit of loose connective tissue, and, critically, what's described as empty space. Now, this space is useful. It lets the femoral vein next door expand when blood flow goes up. But that empty space, well, it's also a point of weakness.
And that potential weakness, well, that's where things can go wrong. This is where we shift from just talking anatomy to why this tiny canal is such a huge deal in medicine.
I mean, it seems a little counterintuitive, right? If it's mostly empty space and it's designed for flexibility, what on earth could be the problem?
The problem is something called a femoral hernia. This is what happens when that empty space gets an unwelcome visitor. A part of the small intestine can actually get pushed from the abdomen through the entrance of the canal and get trapped inside.
So a piece of intestine gets trapped. Okay, that's bad, for sure. But what's the real danger? Why is this specific situation such a massive deal?
So here's the rundown. The femoral canal is a pretty common spot for this kind of thing to happen. It usually shows up as a lump down in the groin area, and it's actually more common in women. That's mostly because the shape of their wider pelvis creates a slightly larger opening to the canal to begin with.
Now, I want you to think back to those borders we just mapped out. The most important thing to remember is that they are tough ligaments. They have zero give. They do not stretch.
And here's the crucial point. When a piece of soft intestine gets forced into this rigid, unyielding tunnel, those hard walls can squeeze it, and squeeze it tight. And when you squeeze the intestine, you're choking off its vital blood supply.
And that leads to a situation that doctors call a strangulated hernia. And let me tell you, this isn't just a problem anymore. It's a full-blown, life-threatening medical emergency. The tissue literally starts to die from a lack of oxygen.
So let's just put it side by side. The difference is night and day. On the left, in the normal state, the canal is just chillin', holding some lymphatics and that useful empty space. But in the nightmare scenario on the right, the intestine gets trapped, and those rigid borders turn into a vice, cutting off the blood supply.
And that's the whole crazy story.
isn't it? A tiny, seemingly insignificant canal poses a major risk, precisely because its own strong protective borders are what become the source of the danger. It's a perfect example of how one small anatomical detail can have absolutely massive consequences.
Which just leaves us with one last thing to think about. We've just seen how a few millimeters of space can be the difference between normal health and a surgical emergency. So what other tiny anatomical details, what other hidden gateways in our own bodies have a massive impact on our health?